Hello to all dear friends. I'm Sophia and you're listening to the Healthify channel. This channel is a specialized channel in the field of health and medicine, where we review drugs, diseases, diets, medical tests and experiments. If you are interested in learning new and useful information in this field, be sure to follow our channel and share with your friends. In this video, I am going to talk to you about a widely used drug called gabapentin. What is gabapentin? What properties and complications does it have? How should it be used? I will answer these questions and many more in this video. So stay with me. Gabapentin is an anticonvulsant drug used to treat partial-onset epilepsy, neuropathic pain, post-shingles neuralgia, and migraine prevention. This drug is a synthetic analog of gamma-aminobutyric acid, GABA, an inhibitory neurotransmitter in the central nervous system. Gabapentin reduces the abnormal electrical current by reducing the activity of subunits of voltage-gated calcium channels in nerve cells and, as a result, disrupts the transmission of pain and convulsion nerve messages. Gabapentin may cause various side effects. Some of these effects are drowsiness, confusion, headache, nausea, vomiting, diarrhea, constipation, weight gain, dry mouth, swelling of hands and feet, respiratory infection, urinary infection, mood changes, anxiety, depression, suicidal thoughts, new or aggravated seizures, severe allergic reactions, with itching, palpitations, shortness of breath or skin sores. Consult your doctor in case of any side effects. Gabapentin should not be stopped suddenly, as it may cause seizures. Stopping the drug should be done gradually and under the supervision of a doctor. Also, this drug should not be taken with alcohol, sleeping pills, antidepressants or anti-anxiety drugs, as it may cause decreased alertness or side risks. Gabapentin is in category B1 during pregnancy and breastfeeding. This means that sufficient research on animals has shown that this drug does not harm the fetus, but sufficient research on pregnant women has not been done. Therefore, the use of this medicine during pregnancy is allowed only if necessary and with the doctor's opinion. Also, gabapentin is excreted in breast milk and may affect the baby. Therefore, the use of this medicine during breastfeeding is allowed only with the doctor's opinion. The right dose of medicine. The dosage of this medicine depends on the severity of the disease, clinical condition, age and weight of the patient. In children, weight is also effective in determining the dosage. Usually, the doctor starts with a low dose and gradually increases the dose until it reaches the optimal level. For the treatment of partial epilepsy, the usual dose of gabapentin in adults is 900 to 1,800 mg per day, divided into 3 doses. The maximum daily dose is 3,600 mg. For the treatment of neuropathic pain, the usual dose of gabapentin in adults is 900 to 3,600 mg per day, divided into 3 doses. For the treatment of post-shingles neuralgia, the usual dose of gabapentin in adults is 1,800 to 3,600 mg per day, divided into 3 doses. For migraine prevention, the usual dose of gabapentin in adults is 900 to 2,400 mg per day, divided into 3 doses. For children over 3 years of age, the initial dose is 10 to 15 mg per kilogram of body weight per day, which is divided into 3 doses. The maximum daily dose is 50 mg per kilogram of body weight. Drug interactions. Some drugs cause dangerous and life-threatening interactions with each other. Be sure to share a list of all your medications with your doctor or pharmacist before starting any brand name treatment. Some medications that may interact with gabapentin include antacids containing aluminum or magnesium. These drugs may reduce the absorption of gabapentin. At least 2 hours should be observed between the use of these drugs and gabapentin. Narcotics. These drugs may increase the risk of drowsiness, confusion, shortness of breath, and sudden death. Some of these drugs include codeine, hydrocodone, morphine, tramadol and methadone. Sleeping drugs. These drugs may decrease alertness and affect your performance. Some of these drugs include zolpidem, zopiclone, Zalplan, temazepam, lorazepam, diazepam and alprazolam. Antidepressants. These drugs may cause mood changes and suicidal thoughts. Some of these drugs include fluoxetine, sertraline, paroxetine, venlafaxine, and bupropion. Anti-epileptic drugs. These drugs may reduce the level of gabapentin in the blood and cause it to be ineffective. Some of these drugs include phenytoin, carbamazepine, lamotrigine, and sodium valproate. Nonsteroidal anti-inflammatory drugs. These drugs may decrease the level of gabapentin in the blood and make it less effective. Some of these drugs include aspirin, ibuprofen, naproxen, ketorolac and nimesulide. Food interactions. Some foods can interfere with gabapentin and reduce its effectiveness. Some of these materials include alcohol. Alcohol may increase the risk of drowsiness, confusion, shortness of breath, and sudden death. You should avoid drinking alcohol during treatment with gabapentin. Grapefruit. Grapefruit may reduce the absorption of gabapentin and make it less effective. You should avoid consuming grapefruit and its juice during treatment with gabapentin. Also, if you are using gabapentin, consider the following suggestions and tips. Take the medicine exactly as prescribed by your doctor and never change or stop the dose or frequency of use. Take the medicine with or without food but avoid alcohol and grapefruit. If you are using a gabapentin capsule, swallow it whole with a full glass of water and do not break or wear the capsule. If you are taking gabapentin tablets and your doctor has told you to take half of the tablet, take the other half of the tablet next time you take it, and throw it away if you haven't used it in more than a few days. During treatment with gabapentin, in order to avoid side effects, be careful and avoid dangerous activities such as driving or operating heavy machinery. I hope you enjoyed this video and gained some useful information about gabapentin. If you have any questions or comments, let us know in the comments section. To see more videos, follow the Healthify channel and share with your friends. Please like and subscribe, and to know more, refer to the sources mentioned in the description.